There's some evidence that there can be slight differences in Gonal-F versus Follistim. Hi, I'm Nurse Suzie, a fertility and IVF nurse, and today we are going to talk about the differences of Gonal-F and Follistim. These are two of the injectable medications that we use when going through an in vitro fertilization cycle. I saw the difference myself when I was going through my 2 retrieval rounds during my experience with infertility. So I want to shed light on this and help some of you who might be dealing with the same issue. Okay, here is one of these studies that cites a difference in the recruitment of follicles using Follistim versus Gonal-F. What this study found is that Follistim does a better job of growing a cohort of eggs at the same time. So recruiting more and growing them to maturity rather than ending up with, let's say, 1, 2, or 3 lead follicles and the rest are not mature. So which one should you use? Unfortunately, we don't always have a choice when it comes to IVF injectable medications. Why? Because of insurance coverage. Okay, some providers or insurance carriers will only cover Gonal-F, others only cover Follistim. So you want to first check with your insurance coverage. If you're only covered for one versus the other, go ahead and go with that first. See how it works for you. Medication is so expensive for IVF, so we don't want to put you out of pocket if you don't necessarily need to be. If you are already self-pay, maybe ask your doctor in their fertility clinic for a Follistim prescription if you have gone through IVF before and you have that problem of having like 1 or 2 mature lead follicles and the other eggs in that cohort aren't. Follow me for more inside information like this from a fertility nurse, from someone who's been on the other side there with you. I am here to help, and I hope this maybe gave you a little bit more information that you wouldn't have found elsewhere.